Welcome to another episode from the Veterinary Research Channel. Today, we delve into a fascinating study published in the Journal of Veterinary Internal Medicine in 2024, which compares the timing of relapse in dogs diagnosed with three different non-associative immune-mediated diseases. These conditions are immune-mediated hemolytic anemia, immune thrombocytopenia, and immune-mediated polyarthritis. This research was conducted by Richard Sparrow, James W. Swan, and Barbara Glainman at the Royal Veterinary College in the United Kingdom and Columbia University in the United States. Immune-mediated hemolytic anemia, often referred to as IMHA, immune thrombocytopenia, known as IDP, and immune-mediated polyarthritis, or IMPA, are significant concerns in canine health. These are among the most common immune-mediated diseases seen in dogs, arising from a breakdown in the body's immune system, leading to an attack on its own healthy cells. In many instances, the precise underlying cause of these conditions remains undetectable, and they are then termed primary or non-associative. Despite advancements in supportive care and treatments that suppress the immune system, these diseases can still lead to considerable illness and even death in affected dogs. A major challenge in managing these conditions is the possibility of relapse, meaning the return of clinical signs after a period of improvement or remission. This is a significant worry for both veterinarians and dog owners because relapses can lead to increased sickness and potentially higher mortality rates. Previous studies have reported varying prevalence rates for relapse across these three diseases, but it has been unclear if the likelihood of relapse changes over time after the initial diagnosis, and if the timing of relapse is similar among dogs with immune-mediated hemolytic anemia, immune thrombocytopenia, or immune-mediated polyarthritis. This uncertainty makes it difficult for veterinarians to provide owners with accurate information about the chances of relapse, when a relapse might be most likely to occur, and how long immunosuppressive treatment might be needed. Therefore, there is a clear clinical need for more precise information regarding the timing of these relapses. While various factors have been suggested as potential triggers for the initial development of immune-mediated diseases, such as infections, vaccinations, medications, toxins, inflammatory conditions, and cancer, strong evidence for a direct cause and effect relationship is often lacking, with the exception of some infectious agents. The relationship between vaccination and the initial onset of these diseases has been explored in previous research. However, there has been a lack of evidence to suggest that vaccination would cause a relapse in a dog that is currently in remission from an immune-mediated disease. The association between vaccination and relapse in dogs previously diagnosed with immune-mediated hemolytic anemia has been particularly unclear. Despite this lack of clear evidence, a considerable proportion of veterinarians in the United Kingdom have indicated that they would choose not to vaccinate dogs with a prior diagnosis of immune-mediated hemolytic anemia, highlighting the significant clinical concerns surrounding potential relapse. Nevertheless, it has remained uncertain whether relapse is actually more likely in dogs with these immune-mediated diseases who do receive vaccinations compared to those whose vaccinations are withheld. This study's primary goal was to compare how often relapses occur in dogs diagnosed with immune-mediated hemolytic anemia, immune thrombocytopenia, or immune-mediated polyarthritis over a period of 2 years following their diagnosis. The researchers also aimed to describe the time interval between the initial diagnosis and any subsequent relapse. Considering the range of relapse rates reported in earlier studies, the researchers initially hypothesized that there would be no significant difference in the rate of relapse among the three different diseases. A secondary aim was to determine how often dogs in the study were vaccinated after their initial diagnosis and to compare the rates of relapse between dogs who were vaccinated and those who were not. The study involved reviewing the medical records of 160 client-owned dogs, 73 with immune-mediated hemolytic anemia, 55 with immune thrombocytopenia, and 32 with immune-mediated polyarthritis. These records were from a referral teaching hospital and covered a 2-year period. The researchers aimed to follow each case for at least 2 years. They calculated the incidence of relapse for each of the three diseases and compared the relapse rates in dogs that were vaccinated after their diagnosis with those that were not. The results of the study provided some valuable insights into the patterns of relapse in these immune-mediated diseases. When looking at the first 12 months after diagnosis, the relapse rates differed significantly among the three disease groups. Dogs with immune-mediated polyarthritis had a higher relapse rate, with 35% experiencing a recurrence of their condition within the first year. In contrast, the relapse rates for both immune-mediated hemolytic anemia and immune thrombocytopenia were 11% at the 12-month mark. Over a longer period, specifically 24 months after diagnosis, the overall relapse rates were 41% for immune-mediated polyarthritis, 18% for immune-mediated hemolytic anemia, and 23% for immune thrombocytopenia. Interestingly, the timing of these relapses also varied among the diseases. For dogs with immune-mediated polyarthritis, the vast majority, 90%, of relapses occurred within the initial 12 months following diagnosis. In comparison, relapses in dogs with immune-mediated hemolytic anemia and immune thrombocytopenia were more evenly distributed over time, with 56% of immune-mediated hemolytic anemia relapses and 50% of immune thrombocytopenia relapses happening within the first year. Some dogs with immune-mediated hemolytic anemia even experienced relapses more than 2 years after their initial diagnosis. The median time to a first relapse was 6 months for immune-mediated hemolytic anemia, 10 months for immune thrombocytopenia, and 7 months for immune-mediated polyarthritis. Regarding vaccination after diagnosis, the study found that it was not associated with an increased risk of relapse across any of the 3 disease groups. Among the dogs with follow-up data available to assess vaccination, approximately half received a vaccine after their initial diagnosis. Importantly, no dog experienced a relapse within 30 days of receiving a vaccine, regardless of whether they were receiving immunosuppressive medications at the time of vaccination. When comparing the proportion of dogs that relapsed and received a vaccine to those that relapsed and did not receive a vaccine, no significant difference was found. These findings lead to several important conclusions and have implications for clinical practice. The study highlights that the risk of disease relapse is highest in the first year after diagnosis for dogs with immune-mediated polyarthritis, and the relapse rate for this condition is higher compared to immune-mediated hemolytic anemia and immune thrombocytopenia. The observation that 90% of immune-mediated polyarthritis relapses occurred within the first 12 months suggests that if a dog with this condition remains in remission for a year, the likelihood of a subsequent relapse may be lower, potentially indicating a more favorable long-term outlook for this subset of dogs. In contrast, the pattern of relapse in dogs with immune-mediated hemolytic anemia and immune thrombocytopenia suggests that these dogs may be at risk of relapse for a longer period, potentially even several years after their initial diagnosis. This emphasizes the need for ongoing awareness among both owners and veterinarians that relapses can occur sporadically in these conditions, even after prolonged periods of remission. Interestingly, the researchers also observed 2 cases where dogs developed a new immune-mediated disease more than a year after being diagnosed with immune-mediated hemolytic anemia. While the underlying reasons for this were not definitively determined, it raises the possibility of the original autoimmune response somehow contributing to the development of a new one, or perhaps an underlying predisposition to developing autoimmune responses in general. This observation suggests that veterinarians should remain vigilant for the development of new immune-mediated conditions in dogs with a history of any immune-mediated disease. The study also found a statistically significant difference in relapse rates at 12 months, with immune-mediated polyarthritis having a higher rate than both immune-mediated hemolytic anemia and immune thrombocytopenia. Although further statistical analysis did not confirm a significant difference between individual disease pairs, possibly due to the smaller number of dogs in the immune-mediated polyarthritis group and the overall relatively low number of relapses. The researchers suggest that the potentially higher relapse rate in immune-mediated polyarthritis could be influenced by the more subjective nature of defining relapse in this condition, which relies on the recurrence of clinical signs rather than objective laboratory values, as is the case with immune-mediated hemolytic anemia and immune thrombocytopenia. It is possible that some signs attributed to relapse in immune-mediated polyarthritis could have been due to other issues, such as orthopedic problems. Another potential explanation for the differences in relapse rates could be variations in treatment approaches. While the study did not find a significant difference in the use of multiple immunosuppressive drugs between dogs that relapsed and those that did not, it is possible that specific protocols for reducing and stopping these medications could play a role in the likelihood of relapse. However, the study found that key aspects of the initial immunosuppressive treatment for all 3 diseases, such as the timing of initial dose reductions of prednisolone, the total duration of treatment, and the initial and reduced dosages, were generally comparable. This suggests that variations in standard immunosuppressive protocols may not fully explain the higher early relapse rate observed in immune-mediated polyarthritis. The researchers also considered that fundamental differences in the nature of the autoimmune response in each disease, or their responsiveness to conventional immunosuppressive treatment, could contribute to the observed differences in relapse rates. The finding that vaccination after diagnosis was not associated with an increased risk of relapse is important, especially given the concern among some veterinarians about this potential link. This observation aligns with recent survey data indicating that a notable proportion of veterinarians would be hesitant to vaccinate dogs with a history of immune-mediated hemolytic anemia. Although the study acknowledges that many dogs were still on immunosuppressive drugs at the time of vaccination, which could potentially mask a vaccine-related relapse, the fact that no relapses occurred within 30 days of vaccination across all 3 disease groups provides reassuring evidence. While a 30-day window is a commonly used timeframe for assessing such temporal associations, the researchers note that it is somewhat arbitrary, and a longer period might reveal different findings. They also point out that variations in vaccine types and individual immune responses could play a role. Nevertheless, the study suggests that the risk of vaccine-associated relapse in dogs with these immune-mediated diseases appears to be low, and decisions about vaccination should be based on a careful consideration of the individual dog's risk-benefit profile. The researchers also acknowledge several limitations of their study. Some dogs were lost to follow-up, which could introduce bias if these dogs differed in their response to treatment or likelihood of relapse compared to those who were followed for the entire study period. The study also could not definitively rule out the possibility that some dogs were lost due to death or euthanasia resulting from a disease relapse. Additionally, there was no standardized approach to initial treatment or the tapering of immunosuppressive medications, which could have influenced relapse rates. The study population was drawn from a referral hospital, which may not be fully representative of the broader population of dogs seen in primary care practices. While most dogs underwent comprehensive diagnostic testing, some did not have certain tests, such as urinalysis, fecal analysis, thoracic imaging, or infectious disease screening, meaning that occult underlying conditions could not be entirely excluded and might have affected treatment outcomes or relapse risk in some cases. However, the researchers argue that the survival of these dogs to discharge, a requirement for inclusion in the study, makes the presence of an undiagnosed infectious disease that would worsen with immunosuppression less likely. They also note that the long-term follow-up would likely have revealed any unmasking of occult infections in dogs receiving immunosuppressive drugs. Finally, not all dogs with immune-mediated polyarthritis had radiographs of their joints to assess for erosive disease, which could potentially affect treatment response, although erosive immune-mediated polyarthritis is considered rare. Similarly, in dogs with immune thrombocytopenia, while diagnosis was made by specialists, the study acknowledges that conditions leading to platelet consumption or sequestration, as well as bone marrow disease, could not be completely excluded in all cases as screening for coagulopathies and bone marrow cytology was not routinely performed. In conclusion, this study provides valuable comparative data on the timing of relapse in dogs with nonassociative immune-mediated hemolytic anemia, immune thrombocytopenia, and immune-mediated polyarthritis. The findings indicate that relapses in dogs with immune-mediated polyarthritis are most likely to occur within the first year after diagnosis, whereas relapses in dogs with immune thrombocytopenia are more evenly distributed over the first 3 years. Furthermore, dogs with immune-mediated hemolytic anemia may be at risk of relapse for several years following their initial diagnosis. The study also offers important evidence suggesting that vaccination after diagnosis does not appear to increase the risk of relapse in these conditions. This information can help veterinarians to better advise owners about the expected course of these diseases and the potential for relapse, as well as inform decisions regarding vaccination in dogs with a history of immune-mediated disease. Thank you for listening to the Veterinary Research Channel. A link for the referenced paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.